Your INSTI HIV Self Test is simple to perform and highly accurate. You may test positive with INSTI HIV Self Test as early as 21 to 22 days after infection, but for some people, it can take up to 3 months to show a positive result. You may get a negative result even if you are infected, if less than 3 months have passed since the risk event. The membrane unit will determine your result. The dots indicating your result will appear at the end of the test. Remember, INSTI HIV Self Test is a single-use test. Once you have performed the test, it cannot be reused. Results should be read immediately and within 1 hour. Before you start, read and follow instructions for use carefully. Make sure that the testing area is clean and well lit. Inside your self-testing kit. Inside your self-testing kit, you will find instructions for use, a membrane unit pouch, bottles 1, 2, and 3, lancet, and an adhesive bandage. Preparation. Wash and dry your hands. When you are ready to start, open the membrane unit pouch. Place the membrane unit on a flat surface. Bottle 1. Remove the cap and place the bottle on a flat surface. Place the cap nearby to recap the bottle after you add the blood. Step 1. Collect blood. Twist and pull the blue tip out of the lancet and place aside. Rub your finger and hand until warm. Secure finger firmly on hard surface and press lancet on the side of fingertip. Press hard until you hear it click. Rub the finger to get a large drop of blood. Ensure a full, free-flowing drop of blood is added to avoid an invalid result. Let one full drop fall into bottle 1. Twist on cap of bottle 1. Apply a bandage. To avoid getting false or invalid results, do not dribble, scrape your finger or blood against the bottle rim, or spill. Stop the test immediately if blood is added to bottle 2. Step 2. Test. Bottle 1. Shake bottle 4 times and pour all the liquid into the membrane unit. Wait until the liquid disappears. Immediately pour the sample on the membrane after adding blood to bottle 1 and shaking. Delays longer than 10 minutes could result in false positive results. Bottle 2. Shake bottle 4 times and pour all the liquid into the membrane unit. You may need to gently tap bottle 2 to get all the liquid out. Wait until the liquid disappears. Bottle 3. Shake bottle 4 times and pour all the liquid into the membrane unit. Wait until the liquid disappears. Step 3. Read the results. Results should be read immediately and within 1 hour. Please refer to the instructions for use to interpret your results. If your result is negative, test again in 3 months. If your result is positive, go to a clinic to see a doctor. When reading your results, one dot may be lighter than the other. If your result is invalid, your test did not work. Repeat the test with a new test. When finished, discard with normal household waste or in accordance with local regulations.